충격파 치료가 여러 해 동안 많은 병원에서 시행되고 있는데 각 병원이나 치료사에 따라 치료 결과가 많이 다르게 나타나고 있습니다. 충격파 치료가 대체적으로 효과가 좋지만 일부 환자는 치료 효과가 없고 아프기만 하다고 하면서 충격파 치료에 대하여 부정적인 이미지까지 갖고 있습니다. 그 이유는 무엇이라고 생각하십니까?
This is a very good question. So in my view, there are a number of issues which relate to the success of the treatment. The first critical factor is correct diagnosis, and this is what our ISMST society is striving, that a correct, precise diagnosis by, say, ultrasound, MRI, whatever tool is crucial to rule out, for example, shoulder pain, where a number of diagnoses might be behind. So first critical issue is diagnosis. Second is the correct choice of the device. So for example, we consider radial and focused shock waves. We are aware that radial is working pretty good on superficial tissues like tendons, like muscles, maybe even for nerves. While we are aware, and based on science as well, that bone edema, stress fractures and so on need high energy by definition by a focused machine. So if you want to treat, for example, a bone edema, it's crucial to use a focused device. And I was yesterday giving the first masterclass in southern India, where radial pressure wave is the predominant technology, and they believed that they could even treat sportsmen with stress fractures with radial only. So the correct device is the second thing. And the third crucial factor is the learning curve. So you have to not only make the right choice to buy the right machine from the right manufacturer, but also you have to learn how to operate this machine, what parameters to use, what applicators to use, how to deal with pain during a treatment and so on. And all of these, with the learning curve of the operator and the medical background of the operator, whether or not it's a doctor, a physician, or a non-doctor, all these come into play when it comes to clinical success of a technique. And I'm aware in Germany that we have colleagues doing shockwaves in a very painful way. So this is what even now in Hanover, Germany, patients tell me that they experienced prior very much pain during treatments, maybe because the parameters were not so well chosen.
수십 년 동안 각종 질환에 충격파 치료를 적용해 오면서 충격파 치료 효과에 대해서 아쉽거나 부족한 점이 있었는지요?
So, based on science, maybe one of the best indications for shockwave and the longest studied indications is calcifying tendinitis of the shoulder. My friend Ludger Gerdesmeyer wrote a randomized controlled trial, I think in 2004 or 5, published in JAMA, showing that 3 sessions of focused shockwave can reduce the pain by some 42-43% after 3 months. So there is still, after 3 sessions, room for improvement because it is 42%. And we just recently made an observation and a randomized control trial on the very same indication, say calcifying tendinitis of the shoulder, with 88 patients. And we compared focused shockwave, 3 sessions. Ludger Gerdesmeyer was the principal author, or the senior author of this trial. And we added in half of the group EMTT, and we found a doubling of the effect after 3 months. So 42% pain reduction in the shockwave group and 88% in the combination group focus shockwave plus EMTT. So there is a surplus in efficacy with the help of EMTT.
최근 독일에서 충격파 치료 효과를 증강시키는 EMTT가 개발되어 충격파 치료와 병행하여 사용하고 계신 것으로 알고 있습니다. EMTT는 어떤 치료 기기인가요?
So EMTT is using oscillating or fast oscillating magnetic fields. It is, let's say, in the field where, for example, pulse electromagnetic field therapy devices, so-called PEMF devices, are much more known in the moment. And I myself started with the EMTT in 2016, so 7 years ago, with a predecessor of the magnetolith machine. The oscillating frequency, and I can show you in the graph, is quite different for the EMTT in contrast to PEMF. So it is known that the PEMF impulse is a sinus impulse over 280 microseconds. And a EMTT impulse is much faster, by numbers 40 times faster than a PEMF. So on the one hand, physically wise, it is much faster. And in a way to measure the strength of the oscillating magnetic field, so-called effective transduction power, measured in kilotesla per second, the PEMF devices are by definition lower than 60 kilotesla. As you see in the slide, the BTL machine or the ZIM-IM field are PEMF devices with 30 or 40 kilotesla per second, while the EMTT devices by Storz, by Papini and others have higher than 60 kilotesla. So EMTT is 40 times faster and from the magnetic field much stronger than PEMF. This is a physical difference.